Hi, my name is Mezabine Lala, and I want to go into internal medicine because I love the holistic review of patients and all of their medical problems and really understanding each individual and their medical complexities as a whole. What it means to be an osteopathic physician to me is about connection. Connection to the patient, to the humanity that unites us all, and to the body as an integrated system. The osteopathic identity is not defined by a single technique or philosophy to me, but by a way of seeing the patient as more than a diagnosis, more than an organ system, and more than a moment in time. Our founder, Dr. Andrew Taylor Still, believed that the body has the capacity to heal itself when given the right conditions. To me, that principle isn't just about anatomy or OMT. It's about faith in the body's wisdom and humility in our role as physicians as we listen before we fix. It reminds me that healing is not something that we do to patients, but something that we facilitate them with. In every rotation and every patient encounter, the osteopathic philosophy pushes me to ask, why? Why is this happening? Not just physiologically, but socially, emotionally. Why does this patient's flare at night when their home feels most quiet? Or why does their hypertension worse when their mother calls? These questions reflect our holistic mindset, one that recognizes the interplay between structure and function, body and mind, health and circumstance. To me, the osteopathic identity also means touch. In a world where screens separate us from our patients, our hands do remain a tool of trust. And osteopathic medicine, to me, is having a tangible understanding also of our patient's body and their dysfunction and their pain, and having a physical understanding of how they may sit or have a tendency to flare up or have a response to pain by really understanding their tissue texture and what is going on. Most of all, the osteopathic identity calls me to service, to look beyond symptoms and beyond socioeconomic divides, beyond convenience, to serve the person in front of me with presence, with compassion, and with integrity. And that is what the osteopathic identity is to me. Thank you.